what are the conditions, doctor, that would require somebody to that would require a bone marrow transplant?
Transplant, yeah. In a common man, if I want to divide them, indications for the bone marrow transplant, non-cancerous and cancerous. First, I would like to elaborate a bit on non-cancerous conditions. There are certain set of diseases where the bone marrow doesn't produce a healthy red cells.
Okay.
Most probably inherited diseases. We heard of thalassemia, sickle cell anemia,
yes,
where the children are dependent on a transfusion. The donor is available and we can change that condition, replace those bad cells with a good one. We can make them a transfusion free. These are conditions, thalassemia and sickle cell anemia.
Okay.
There are other non-cancerous condition called as a bone marrow failure, aplastic anemia, where the bone marrow suddenly stops producing any cells,
okay,
where we take a donor cells and put to them. There are certain inherited immunological disorder, we call it as SCID, basically
yes,
inherited bone marrow failures, we call it as, where the bone marrow, due to certain genetic condition transfer from the parents, suddenly starts not functioning, where
okay,
we do a transplant in such cases. Coming to cancerous conditions, there are leukemia, lymphoma, myeloma, where we replace the malignant tissue which is refractory or not responded to the conventional therapy with healthier cells.